Hi, Monique. How have you been?
I've been good. I've been really good. I'm working on planning a trip to the Bahamas. I'm so excited.
Okay. That's yeah, that sounds wonderful and like something to really look forward to.
Yeah, I'm taking my son too. So it will be his first trip on an airplane. And so we're just going to take a nice vacation and just have a really good time and just really just relax because that's what I've been needing.
Yeah, that sounds really nice. Um, well, Monique, I know we have been working together for a little while now, and
Mhm.
I can see how much progress I've really made here. Pretty soon, though, we will not be seeing each other anymore. What are your thoughts on your progress and time spent here?
I mean, honestly, I feel like time has really flown by. I can honestly say I feel a little lighter with my anxiety, and I've been working on my self care and giving myself things to look forward to as well, like this trip to the Bahamas, and just really trying to put myself first and really working on the goals.
Right, self care was one of your goals. Um, so, how do you feel about your progress on this specifically?
Well, I am back into a regular workout routine, and I've been working really hard at making myself a priority. And I guess I've really accomplished this goal.
Okay. Well, that's really incredible. You know, don't forget that healing isn't linear, and it's okay if you aren't on that constant, uphill climb. Okay. It's okay to stay the same some weeks or some days.
Yeah, that's
So, the treatment modality that you and I have been working on together was solution focused therapy. So, this is a method that we know was short term intervention. But I wanted to let you know that cognitive behavioral therapy is another form of treatment that you could try with another therapist too, if that's something that you would be interested in.
yeah, I've actually made a lot of progress with you, and I think I would like to continue to work on my anxiety.
Okay. Um, right, which brings me to, your diagnosis that we've been uncovering together, and it's something else that I wanted to discuss with you.
Okay.
Um, so after the time we spent together learning more about your symptoms and challenges, your symptoms align with a generalized anxiety disorder.
Okay.
Your anxiety symptoms, they've lasted longer than 6 months, and it's caused you to experience intense feelings of irritability and restlessness. You mentioned struggling with symptoms of tiredness too. Is that correct?
Yes, that sounds correct. That's right.
Okay. Do you have any questions about your diagnosis?
Um, yes, actually, I do. Is this something that I can manage on my own, or do I need like medication? My mom is on medication, and I just don't think I want that. So I don't want medication. I don't want that to change who I am. So if this is something I can manage on my own, I really think that's something I would like to do.
Yeah, of course. That's certainly understandable. And if you would like to work more with another therapist using, the cognitive behavioral therapy approach I mentioned before, we would certainly be able to arrange that. A CB therapist would work in collaboration with you to identify patterns of behavior in thought process and how they are serving you. It also, gives you a chance to dive deeper into how and when you may have formed, your developed your core beliefs that have shaped your thinking. Sorry about that.
It's okay. But yeah, that just sounds interesting, and it's something I am willing to do.
Okay. Well, then let's get you connected with one of our therapists who specializes in that. Do you have any concerns with the type of therapist that you might connect with?
I think I want a female for sure. I don't know how I would feel working with a male or how he would be able to understand the struggles that I'm going through as a woman, you know?
Yeah, absolutely. That makes perfect sense. I think Jennifer would be a good fit for you. Let's get that scheduled. Does that sound good?
Yes, that sounds perfect.
Okay. Well, Monique, do you have anything else that you would like to discuss?
Uh, no, um, not now, but I do want to say thank you for all your help and helping me work through my anxiety because it has been a lot. And I wasn't really fond of therapy. And so when I did decide to go and seeing all the progress that I've made and me really reaching those goals, I'm like, this really works. So just want to say thank you.
Yeah, no problem at all. All the credit and progress that you've done here really goes to you. You're the one that put in the work, so you really should be proud of yourself, and I know that I'm proud of you too.
Thank you. I am proud of myself.
All right. Well, then I'm going to go ahead and reach out to, the front desk and make sure that we can get that appointment set out for you with one of the other therapists we talked about, Jennifer, okay?
Okay, thank you so much.
All right. And if you need anything at all in the future, don't hesitate to reach back out, okay?
I will. Thank you.
Thank you.